In October, an internal medicine physician named Dr. Brian Lenskis, I hope I said that right, wrote this. I wonder why doctors who questioned the safety of Vioxx were never called anti-pain management and threatened to have their medical licenses revoked. Got about 5,000 views just from that little sentence, and he's very specific when he puts up his tweets, or X's, I guess you can call them now. So that got me to thinking, what he's not saying is, why are doctors being sanctioned and their licenses threatened to be revoked by having questions about shots? So I looked up to see how many physicians strongly feel that these shots are safe. And the answer, 67.5%. So that means that over 30% of physicians aren't completely sure that they're safe. 96% of them have taken them, probably because they were told, if you don't take these shots, you can't practice medicine at our institution. It happened to me. The one time I got a flu shot and I got the flu, I was told you have to get this shot if you want to practice medicine at our hospital. I kind of objected to that. And they said, well, you don't have to, but you just can't practice at the hospital. Well, that was a significant amount of my practice was being in a hospital. So I acquiesced against my better judgment, and I got the flu. So let's talk about Vioxx. Vioxx was voluntarily withdrawn from the market after a report showing an increase in heart attack. The maker of the drug was Merck, and actually, if you go back in time, the drug was originally found and formulated by Monsanto, who also found and formulated Celebrex. They're both cyclooxygenase 2 inhibitors, so COX-2 inhibitors. Vioxx taken off the market. It wasn't banned, it was voluntarily withdrawn. Celebrex remains on the market and has been given, since that Vioxx ban, to 35 million patients, and has the exact same mechanism of action and the exact same cardiovascular risk profile. It's interesting to me. Also thought I would never see doctors get sanctioned and censored and put on probation and their licenses revoked for using a medication that is on the essential list of medicines by the World Health Organization, for using that medication off-label. It is specifically approved for a certain type of treatment, but 1 in 5 medications at any given time in the United States is written off-label because they work. And in certain conditions, about 90% of the time the treatment that is used is off-label, meaning it's a 3-letter administration approved medication used for a different indication. And since my ADD mind is bouncing back and forth tonight, we'll go back to shots. In May of 2022, 17,000 physicians and scientists asked for the rollout of certain shots to be halted until they could be proven to be safe and efficacious. So presumably those scientists and physicians are in that 30-some% group that isn't entirely and strongly sure that those shots are safe. Things were weird before 2020, they just keep getting weirder, or the veil of secrecy is being lifted and you're all seeing it. Have a great rest of your weekend, and I'll talk to you tomorrow. See ya.